Now this morning, are you a good candidate for Botox? You could have some qualities that actually make you a bad candidate. Dr. Michael Kim is joining us in the studio now with what you need to know.
Excuse me.
And his cell phone's still on. Doctor always has his phone on, right? Good morning.
Good morning. So, yeah, Botox is the most common procedure. We see like about 6 million people last year had Botox compared to about 700,000 about 10 years ago. So it's a huge increase, and it's a very common procedure in spas, med spas, family doctor's office, dermatologist, plastic surgeon. So, you know, a lot of these places, these med spas are more of a business than a physician. So you have to be really careful because when you go into a med spa selling Botox, it's like almost a sales pitch, and pretty much everyone's a candidate. When you come into a plastic surgeon or a dermatologist's office, often we're more conservative because if a patient is not a great candidate. So basically Botox, remember, it relaxes the muscles that causes wrinkles. So wrinkles that come and go, like upper right, that crow's feet, is a great candidate because you can just see after the Botox.
Wow.
Right, so when you squint in the sun, you don't get those crow's feet. Also, those worry lines in the middle, that furrow, that angry look can be significantly improved by Botox. So those patients are great candidates. But if you go to the next slide, patients who obviously on the upper right, believe it or not, I have patients on the upper right that come in just like that, all these wrinkles, you're 70 or 80 years old, asking for Botox. They've been treated elsewhere and they didn't see an improvement. They wonder, and you know, I'm just thinking, you know, where did you go? Because obviously you're not a great candidate. Once the wrinkles get embedded in your skin and they become divots, there's really not a lot of improvement with the Botox. You have to move either towards surgery or maybe fillers. But and in men, you can see in the bottom left, a lot of men and some women have very heavy brows. So you have to be careful when you hit about 40 or 50. If you do a lot of Botox to try to get those wrinkles across the forehead, you can see on the left bottom how much it drops the brow, and a lot of people hate that look. So you really have to be careful. If you have a heavy brow, those patients aren't great candidates. You can put a little bit, but you can't eradicate the wrinkles because those wrinkles are providing a function of elevating the brow. So those patients have to be very careful. You can see on the bottom right again a heavy brow, and you can see, you know, you have to worry about spot looks. Some people have these unusual anatomy. On the bottom right, you can see that she kind of looks like Spock.
Yeah, that's what Kate Gosselin, and she definitely had some major changes.
Yeah, you know, some people like that look,
years.
but you know, I think that people just have to be careful. I think that some people are fillers a better option. You can see on the left side, instead of Botox, we actually can fill in the wrinkle with a filler, like Wrestler Juvederm or one of the other fillers. And so it basically fills in the divot because Botox, no matter how much you relax the muscles, that divot will not go away. So to treat Botox there probably won't be adequate and only lasts 3 months. If you put filler there, it can last anywhere from 6 months to 2 years depending on the area of the face. So a lot of times I'll recommend fillers to fill in certain wrinkles in older patients because it works a lot better.
Botox actually paralyzes the muscle, so it's been used in other parts of the body as well for sweat relief and that sort of thing.
Yes, as a matter of fact, the original use was for neck pain and spasms in kids and torticollis, all those spasm problems in the neck. So this we're using cosmetic as a secondary use, but it's very helpful. The main issue is expensive. It only lasts 3 to 4 months. And you have to make sure you're a good candidate. So it's important when you go in to see somebody about this to make sure that you're a good candidate, because if you're a little bit older, you got a lot of heavy brow, you got super deep wrinkles, it may be not the best option. So make sure before you go and you go to someone that may be honest and give you an honest opinion.
All right. Thank you so much, Dr. Kim. We appreciate it. Let's send it over to Rob Spicker now with more.